This video will give you general information about the process of induction of labour and the possible risks, benefits and alternatives. When your doctor or midwife recommends an induction, you can expect that they will explain why induction has been recommended to you, the possible risks to your health or your pregnancy if you wait for labour to start naturally, the possible risks if you have an induction, what an induction of labour involves. Sometimes, complications can arise during pregnancy that make it safer for your baby to be born before labour starts naturally. There are two ways to bring our baby into the world before labour has started: via an induction of labour or via a planned caesarean section. The plan for bringing your baby into the world before labour has started will be between you, your obstetrician and midwife, and you can discuss any questions or concerns you have with them. In Australia, approximately 1 in 3 labours are induced. Induction of labour is a procedure used to stimulate uterine contractions before labour begins on its own. The most common reasons for women being recommended an induction are being past your due date, having high blood pressure, having diabetes, other medical conditions in the pregnancy, or if there are concerns about your baby's well-being. An induction is usually a 3-step process. However, not all women will require all 3 steps. The steps you need depend on where you start in the process and how your body responds. Step 1. A medicine or a device may be used to soften, shorten and open your cervix, which is the lowest area of your uterus. Step 2. Breaking your waters, artificial rupture of membranes. Step 3. A medicine, oxytocin, may be used to start your contractions. Step 1. The first step will be recommended if your cervix requires softening, in order for clinicians to be able to break your waters. There are 2 ways to soften, thin and open your cervix. 1. A medicine, usually a gel, known as prostaglandin, or 2. A device known as a balloon catheter. Your cervix is closed during pregnancy and opens towards the end of your pregnancy and during labour to let your baby pass through your vagina and be born. Either a thin plastic tube is placed inside the cervix, or a gel is given into the vagina. This helps the cervix to soften, thin out, and open up enough so that the waters can be broken. Your doctor or midwife will discuss with you which method they recommend and why. Step 2. For the waters to be broken, an internal vaginal examination is done by either the doctor or the midwife. The cervix needs to be 1 to 2 centimetres dilated for this to happen. A small hook is used to create a hole in the sac around the baby to release the fluid from around the baby. This is sometimes called an ARM, or artificial rupture of the membranes. Step 3. Once the membranes have been ruptured, it is sometimes necessary to stimulate uterine contractions with a hormone called oxytocin. This is a synthetic hormone, similar to one your body makes to go into labour. It is given through an intravenous drip into the bloodstream. The induction process may take place over 1 or more days. Every woman and every labour is different. In recommending an induction, your doctor or midwife believes that the benefits to you and/or your baby exceeds the risks involved. The risks and possible complications depend on the reason for your induction, the method of induction, your individual situation. The most common risks of being induced are contractions that are too long or too frequent. During an induction, the uterus may be overstimulated. This may cause the uterus to contract too often. Too many contractions may lead to changes in the fetal heart rate. If there are problems with the fetal heart rate, oxytocin may be reduced or stopped. Other treatments may be needed to help the uterus to relax and contract less. Labour does not start. Some women's bodies do not respond to induction hormones. A healthcare professional will explain your options. Bleeding. Women who are induced are more likely to experience above average blood loss after the birth. Pain. Pain relief is more commonly used with an induction compared to a spontaneous labour. There are also some potential benefits to consider when you are making the decision to have an induction. Planning time of birth can facilitate specific care that your baby may need when they are born. Improvement in some medical conditions associated with pregnancy, example preeclampsia. Reduced risk of infection. Reduced risk of complications during the birth related to your baby's size. Reduced risk of stillbirth. What happens if you don't want to have an induction? The decision to have an induction is yours to make. You may go into labour on your own, or you may have a caesarean or induction at a later date. If you decide you do not want an induction now, your obstetrician and midwife will discuss alternate options. It is important that you understand the benefits and risks of waiting for labour to start on its own, as well as the induction. This will help you decide what is right for you and your baby. Informed consent involves voluntary permission given by a person or advocate for treatment or procedure after being informed of the purpose, method, and possible risks, benefits, and alternatives. At Mater Mothers, we respect your right to decide on what care is best for you. You will continue to receive respectful care within the parameters of your consent throughout your pregnancy, birth, and parenting journey.